Good day, South Africans, fellow South Africans, all the kings and the queens, all the brothers and sisters, all the sons and daughters of South Africa and of Africa and the whole world. Thank you for this opportunity that I can come and talk to you whilst it's still legal to speak up our minds. We know that the Bible says, "My people perish because of lack of knowledge." Now, the Bible instructs us to be people who will stand up for the truth. Now, whilst yesterday we listened to the State President of the Republic of South Africa, the Honorable Cyril Ramaphosa, addressing the nation on the challenges that are facing this country because of this disease called COVID-19. Now, we just want to say something, express our opinion. We cannot claim to have all the wisdom, but we want you to think about what we are saying based on the statement that the state president delivered yesterday. We know that this coronavirus was discovered on the 1st of December in 2019 in Wuhan, in China, and it has rapidly spread throughout Europe and all the countries of the world. And sadly, many people have lost their lives. Many people have gone through some trials and tribulation and suffering. And we have seen how it has affected the whole world. I just want to put on record that Grace Radio, which is an online radio station, which is found on ndstream.net/Grace Radio, based in Vanderbijlpark in South Africa, reported on the discovery of this coronavirus as early as December 2019. But it would seem that we are under the assumption and the impression that it is a disease that is only happening in China. Unfortunately, it has spread throughout the whole world. And I'm reminded that on the 11th of January 2020, Mr. Cyril Ramaphosa, and I'm addressing him in his capacity as the President of the African National Congress, the ANC, he delivered what is known as the January 8 statement. We know that every year there is the January statement when the ANC was established in 1912. So all the presidents of the ANC will address the members of the ANC. And that January 8 statement was held in Kimberley in the Northern Cape province. And Grace Radio was also present at that January 8 statement. And I'm in possession of the full statement that was delivered by Mr. Cyril Ramaphosa as President of the African National Congress. What is clear from this statement is that there is no mention at all of the coronavirus in his statement. Although coronavirus was already in existence. It was already known, and it was being reported in every news bulletin on Grace Radio. Now, in part of the statement, there is the part where he calls on the nation to act. He speaks to various sectors like the workers, the young people and students, to women, to civil society and all other formations, to the faith-based organizations and leaders. This is where my focus comes in. He says, we call on faith-based organizations and leaders to continue to provide spiritual and moral guidance to society, to challenge crime and corruption and violence, and to care for the poor, the marginalized, and the mistreated. Now, soon thereafter, there was the first case of coronavirus in South Africa. And when it was discovered, the president and also the Minister of Health, Dr. Zweli Mkhize, stood on the podium, the platform and social media platforms, to say that South Africa is ready to deal with the coronavirus. They've taken all the necessary steps to deal with this disease. We can commend them that stringent measures were taken. The country went on a hard lockdown under level 5, and yes, the trajectory of people who died came down. Now, I want us to look at the facts and also analyze those facts. It is estimated that the number of people who live in the Republic of South Africa, according to the census, the population is estimated at plus minus 59 million people. And so far, the government has encouraged people to go and test so that they can know their status concerning COVID-19. Now, according to the government sources, the number of people who have tested for coronavirus to date is plus minus 6 million people out of the population of 59 people, meaning about 53 people have not yet been tested. That would also include young and old people. Now, out of the 6 million people who have tested for the coronavirus, only 1,011,871 have tested. But we have just rounded it off. Let me give you a rounded up figure to say the number of people who have tested positive for coronavirus is plus minus 1 million. The exact number is below. But just to give us a round figure, we have just said it is 1 million out of the 6 million we have tested so far. This means, in fact, that the number of people who have died so far, This is the official number of people who have died of coronavirus in South Africa. And it means it is 27,071 people, but we have rounded it up to 27,000, meaning from March until December 2020, from the time that coronavirus was discovered up to today in December, the 28th, the 29th of December. And also, of those who have tested, we said it is 1 million, and 27,000 have died so far, meaning the recovery rate of people is high. It means the number of people who have recovered from coronavirus in South Africa is more than 800,000, which is 974,000 people who have recovered. It means these people were at some stage sick, but now they have recovered. And then the estimated number of active cases for COVID-19 is plus minus 130,000 or 134,900. And it means if 6 million people were tested, only 1 million tested positive. It goes without saying that 5 million people have tested negative for coronavirus. Now, we know that according to the census, the population of South Africa is gradually increasing. And we know that not long ago it was 57 million, but now it has reached 59 million. It is because they compare the death rate, the mortality rate, and the birth rate. So it means more people are being born than the ones who die. Now, our birth rate in South Africa, it means the number of people who were born in South Africa in 2019 is 19,995 per 8,000 people. And the mortality rate, it means the number of people who have died in the Republic of South Africa is plus minus 500,000, meaning there is 9.44 per thousand people who have died, which is lower than the 19.9% per thousand of people who were born in South Africa. Therefore, taking the whole population of South Africa, we can say that the percentage of people who have died of coronavirus in South Africa, comparing it with the whole population, is only 0.046%, meaning it is not even 1% of the population of South Africa that has died of coronavirus. Now, even before we go there, it means the mortality rate in South Africa was that 9.44% out of 1,000 people, meaning 500,000 people die each year. In 2018, in 2019, assuming that in 2020, the same more or less number of people was going to die. Then if we subtract 26,000 or 27,000 from 500,000, it means a very small percentage of the population have died of coronavirus. There are other causes of death. It could be cancer, it could be HIV, it could be natural causes, it could be any other chronic disease or any other cause of death like accidents that are unaccounted for. So when you compare the number of 27,000 out of 500,000 people who die in a year. Let us go in 2019, pre-COVID. 500 people died. There was no coronavirus then in 2019. Coronavirus was discovered here in South Africa in early March, and for now, 27,000 people. Are we saying these are the only people who have died in South Africa? Or there are many other people who have died not of coronavirus? So it raises a question whether people are dying of coronavirus or not. Now, in his speech yesterday, the president mentioned several things concerning the spread of this coronavirus. And he mentioned that there is a new variant called 501.V2, which was discovered apparently in Cape Town in South Africa. My question is, why was this variant discovered in South Africa and not in other countries where there was a high number of people who were infected with the coronavirus? For example, in the USA and other countries. Why was it discovered only in South Africa? And if it was discovered in South Africa, how did it come into the country? What was the source of this new variant called 501.V2? The president mentioned that the coronavirus is spread because of what he calls super spreader events, like the one which took place in Devon called the Matric Rage, where allegedly 1,000 people came from Gauteng and went to Devon, and when they went back, they were infected with the coronavirus. Now, he mentioned that events such as year-end functions, family and social gatherings, music and cultural events are the ones which contribute to the spread of the coronavirus. The rationale and the argument is that when people have taken in liquor, they forget to wash their hands, they forget to sanitize, and as a result, that is how this coronavirus is spread. My question is, how many year-end functions were done in South Africa? I don't think many companies had the money to do those normal year-end functions. Those who did were indeed fortunate. When you talk about family gatherings, you need to be specific who are you referring to. Because if a family has been living together since March up to now, how will they spread the infection? Unless somebody from outside, from another province, comes into the family. But if it's a family gathering, one family that has been together, chances of a spread of coronavirus are minimized. It can never be called a super spreader event. He said cultural events. The question is, does it include the church? The regulation that has been given, it says it prohibits all social gatherings and cultural events, including the church services, for 14 days until otherwise notified. Now, this is where I have a problem with that regulation. Has there been any case or cases that are recorded of people who were infected in the church services with the coronavirus, except the first incident which occurred in Bloemfontein in early March in the Free State, when people, pastors came from Israel and America, and they congregated, and apparently some people were infected at the same time. The question is, why were these people allowed into the country without being first screened? And why do you blame the church for that? Since that incident, has there been any other incident that involves the church, where we can say the church is to blame for the spread of the coronavirus? It is normally said, action speaks louder than words, and that there are formal, verbal ways of communicating and non-verbal ways of communicating. The president instructs us to wear our mask. Yet when we watch him on TV, he's not wearing a mask. Maybe the place where he is has been sanitized. Maybe he's in a bubble and he's safe. But the impression that he gives to us, what we see is him not wearing the mask. How do you expect the population to wear the mask when they see you not wearing the mask? Are you not supposed to lead by example? Is it impossible to speak with a mask? There are rules that if you are found in public not wearing a mask, you will be arrested and sentenced up to 6 months imprisonment or fined a certain amount, or both. Who is going to enforce that rule? Is it the police? Will the police be everywhere? When the hard lockdown started, the army, the South African National Defence Force members were sent. And we saw cases where people were brutally assaulted, some even killed for not wearing a mask. What steps are we going to take to enforce? What minimum force is going to be used to enforce this regulation? If somebody resists being arrested, is he going to be pushed and kicked? Are our prisons going to be full of people who are not wearing masks? If a child of, say, 6 years is not wearing a mask, is he or she going to be arrested? Or is the parent going to be arrested? Because we go around in our communities and we see young people not wearing masks. So what are you going to do? Are you going to arrest them, or they are excluded from that rule? At what age do you start arresting a person for not wearing a mask? Those are the questions that we need to ask ourselves. That is it working? Are people brought to fear? Are people being driven to a vaccine? Now, we know that the population of people who have died in South Africa of coronavirus is less than 1%, is 0.046%. Now the government is saying they're going to bring a vaccine. They're going to bring a vaccine. Remember, the population in South Africa is 59 million. Yet out of 59 million, only 1 million have tested positive. Yet the government has promised that they will give 10% of the promised vaccine to the population, starting with the frontline workers, the nurses, the doctors, and all other people, meaning 10% of the population of South Africa is plus minus 6 million to round it off. Otherwise it is 5.9 million people. Are you going to give the vaccine to people who are not sick? And what is the reason for that? These are the questions that we need to ask ourselves. And I'm challenging you that you should think about these things. Look at the facts and apply your minds and make your decision. I cannot decide for you. It's up to you. Nelson Mandela said, "It is in your hands." And may God bless you. Amen.